And I'll put the link in here for the data services guide and specifically the workshops, so you can get the Finding Data Sources PowerPoint for this lecture here. Okay, I think so we don't waste anybody's time. I'll start the lecture. Welcome, thank you for joining us. This is Love Data Week, which is an international week that is for celebrating and sharing all the different things about data, the importance, how to take care of it, how to find it in this case, the importance of data in general. And so for today, I'm going to talk to you about finding data sources specifically. My name is Margaret Henderson. I'm the Health Sciences and Research Data Librarian here at SDSU. I've been here for 7 years. I work mostly with public health, exercise and nutrition science, but also all the other health sciences and biomedical sciences when it comes to data. And I've been doing this for almost 40 years, working with biomedical researchers in a university setting. So the first part that we're going to look at, well, actually first, sorry, this doesn't want to do what I wanted it to do, sorry, is looking at what we're talking about when we're talking about finding data sources. Data is the raw numbers, the counts, things that you collect specifically. You can see here at different levels. The data set is a unit of data storage. So if you've collected the number of people doing something or collected blood samples from a number of people, those kinds of things, those would be your data set, that entire group that you've got. And you can see it may not represent the entire population. In fact, usually it doesn't. Statistics are after the data and data sets have been analyzed and summarized. And so a lot of what we see is compiled statistics. And presented as tables and graphs and sometimes even in maps, those kinds of things. So just so you're clear, the different things, we're mostly looking for data sets when we're talking about it in this case. I first wanted to do a quick overview of what data management is, because this is important to understand when you go looking for data, what you should be looking for, what should those people be doing. And there's a reason for that. You can see this is an older tweet long before X. And there was this hashtag of overly honest methods. And this was one of the ones that was specific to data. They can't send the original data. They don't remember what any of their Excel file names mean anymore. Here's another one where these authors, this was the second paper, and I believe they lost several more from a site called Retraction Watch. And they didn't know they had to keep the data. So they have all these papers being withdrawn because they can't show the data that they use. So there's lots of reasons for keeping data and taking care of data. This is just a couple of examples. Here's a whole list of benefits. And the one that we're specifically interested in is we are less likely to be missing data or notes when it comes time to process and analyze the results. But also when you share the data, that you're going to have that information for people who want to use the data. And I always love this particular cartoonist, and these two cartoons. We've got what happens in real science. Can you save my work? And here's the person saying, what are your data files? What format are they in? How many logbooks? Which shelf? What about the old cabinet? All those different kinds of things. So there's all sorts of things that you need to be able to save data. But in the movie, the scientist just says done. Never, there's no sense of what goes on around saving all that data. Also, the real scientists, we need you to replicate this research, and you can say, I can barely understand the writing. The graphs have no legends, raw data pasted everywhere, no experimental context. And in the movie, the scientist just says, give me an hour, I can do it better. So the reality of data is usually that it's messy. And so data management plans are specifically trying to make sure that there's reproducibility and transparency. These are important. The National Institutes of Health, the rigor reproducibility requirements for grants are really important, and there's training for this. So that's the whole idea when we talk about data management, is we want that transparency in the research that you're doing, and other people need to be able to reproduce what you're doing. And so if they want to reproduce, you have to save these things or reuse in the case of what we're talking here when you're looking for information. And so every data and a lot of agencies, not just government agencies, are requiring data management plans when you do research. And the idea of the data management plan, the documentation, is it's going to outline how a researcher is going to collect their data, organize and describe it, and the description is especially important. Backup, store, and share. Again, the sharing is important for what we're talking about today. So the data management plan is, if there's a good one, it should give us data that we can look for later and reuse. So important parts of this: describe your data, document your data. So look for things like a README file that tells you about the data, some metadata that is attached to that, or a data dictionary. And the README files should include there's all sorts of different things they might include. Names and contact information, a list of what's in that data set, if there's copyright or licensing information that you need in order to reuse it, maybe some limitations, funding support, and who the institution that's responsible for it, any information that's necessary for someone to replicate the work if needed. That's the idea. And we also want to collect the data so it can be used. So you can see when you're searching for a data set, you want something that looks like this top area. We've got nice columns that are labeled. Presumably, there's going to be a data dictionary or README file that tells me what each of these things mean. It's not going to be this jumble where I can't tell anything. I can't tell if the same things were collected. I can tell nothing from this. So when we're trying to share data, we want to look for something that's going to help us be able to use that data. Data dictionary is a good way to do that. It's going to define the terms used. It's going to explain units. It's going to explain how it's recorded, those kinds of things. So here is something that has that. We've got this table that we're working with. And then there's another part of it that tells me exactly what these things mean. So the policy stipulations, you can see there's the columns here. This tells me which each of the columns in this policy stipulations mean. The support provided. And I can't remember exactly where everything is on here, and unfortunately it did not copy well. But you can see there's various policy stipulations here. And so all that information is listed in here, exactly what it means. So in this case, you can check your downloads. So this is something that I'm going to show you in real time so that it's a little clearer. This is preterm and very preterm births live. It's from the California Open Data Portal. And you can go through this and search for anything you want that's California data. You can see it tells you here exactly what this means. There's additional info about the public access level. There's the rights we were talking about. The contact, who's looking after this. Some linkages to the source when it's been updated. So there's some of the information that we're looking for when it comes to a data set. And then we are first looking at this data dictionary. And so it tells me what each column has. So there's going to be 8 columns. It tells me what's in there. It tells me the definitions of what exactly is meant by each one of these. So, confidence intervals, it tells me count of preterm or very preterm live births, and then the total count of live births within the year, all for that particular race and ethnicity. And so here's the table I can download. This is just part of it. You can see there's lots of entries in this. And so because I can only see a certain number per page, but I can download this There's a data dictionary download. There's a full screen. There's a download out here. There's an API if I want to use APIs to go in and get it. You can see I've got different types of files that I can download. So all that information is here. And because of that data dictionary, I know what these upper and lower confidence intervals actually mean. I know about all the different race and ethnicities that I'm going to be seeing coming out of this. I can see how many years are in here, that kind of thing. So by thinking about those things, as I was talking about, these data dictionaries, that's going to help me. I need to look at all that information in there. And then there's a zip file that has all of it in. So I can get an idea of what is available. And does it have all the information I need to actually reuse this? So the data dictionaries are an important thing to actually use. So after all that, just the basics of where you might go or rather what you are looking for when you get to a site that has data in it. Now we'll go to actually finding data. So there are several ways to find data. The major ways to look at it, you can search for an article on your topic and see what data they use. You can check what the library has. You can go to an agency you know of to see what data they have. There is a registry of research data repositories that you can go to and search by subject, or you can Google it. So we'll look through some different ways to do that. We can get data from an article. And so here, I can go to an article here. Okay, obviously my link is not working. Oh, it was that link. So PubMed, I can go to PubMed article. Sorry. Um, let's see. Births, preterm. So just use something like that. I can look through these articles. I have this associated data article attribute. And so I can get some articles that have data associated with them within the articles. And so that will lead me to the data. I can just even read the articles of what I'm interested in and see if they mention a particular data set. So that's one way that I can look for articles. Another way is there are working papers. In this case, these are coming from the Center for Health Economics and Policy Studies. And so I could look at any of these and see, do they mention a particular data set? So I can take a look at some of these and see what data they mention in them. Go through and see, what's in the appendix, things like that. So the other articles they're in. So all sorts of ways like that. What I'm interested in, finding a paper, reading about it, what data did they use? So that's one way. It's not always efficient, obviously, but it's one way to get data on the topic you're interested in. And sometimes it can be helpful, especially looking through PubMed, because you can make sure you're doing original research. If somebody's already done the topic you're in, you want to make sure that you do something slightly different from what they've researched. There are also research guides and library resources. So we have a couple of guides. Here's health statistics, and then there's another data guide as well. And so here we have local California statistics, SDSU statistics. There's a list of United States agencies that provides all sorts of different, and just be aware that because of the government right now, some of these things may not be available because they have been taken offline for various reasons and may or may not return. But there's also global data as well. For the United States, there's going to be also, like this is from United Health Foundation, there's going to be some things that are done by non-governmental organizations. And so some of those will be helpful to like the Kaiser Family Foundation as well. Those might be helpful for continuing to get data if we can't get everything we want from the government. So those are places that you can go to find data. Various government agencies, data.gov, the census data. There's state data, lots of California state data, and even San Diego County. There are all sorts of different information that they have, demographic information, health data that they have. So they have a whole data unit. And in fact, some of the public health graduates here work there. I know a couple of them. So that's available here. And you can see there are dashboards and things you can use to learn more about San Diego County. So lots of different game. Wherever you're interested in, there's going to be government agency things that you can do. Whoops, sorry. There's a National Center for Health Statistics. Again, that's part of the CDC, but this topic list is working. And so you can go through and easily find, immunization things. And you can see there's going to be warnings on these about the website complying with this. So that means, some things may be missing, but you can see that there's all sorts of different data that you can go to. The other thing to remember, especially things like the CDC, some of the government data, sometimes you're going to be able to download it immediately. Other times, here's a PDF version, there's key findings information. I'm just seeing if they've got a specific data set. So they give you all of the statistics that are coming out of it. And let's see. So here's data sources. And so now we can go to that National Health Interview Survey, and we can find out about the data and look at the publications. In some cases, they'll tell you when you can use that data. Other times you might have to do an IRB, fill out forms to be able to get to the data. So that's always a possibility with any of these things. The Behavioral Risk Factor Surveillance System is another one. There's a data user's guide. It gives you all the documentation you need. So all of this is available for these different things. And I think that's the next slide, is that Behavioral Risk Factor Surveillance System. So another big survey that is coming from all the states. Other things like the Environmental Justice Index. Again, we don't know what's going to happen here. We can take a look. We don't know what's going to happen with all of these. You can see this one, because it's environmental justice, it's unavailable. And when that happens, you can ask if you get something like that with government data. There are other places we can look to find some of that data. One thing we do have access to, and SDSU is a partner, so we can get controlled tier access. And there is a guide for the All of Us Researcher Workbench that gives you more information about that. I need to clean that up. I thought I changed it this morning, but I guess I didn't. But we have access to this, and I will make sure that the link to the original introductory workshop is there. And we will put that up for you so that you can see what it's like to use that data. But this gives you things, they want to have the genomes and Fitbit data and electronic health record data from up to 1 million or more Americans. And so there's a researcher hub. Again, you have to go in and you have to get access, but then you can create your own data sets of the different groups you want, people with a particular diagnosis, those kinds of things. And so particular demographics. So this is another research project where, with registration and going through something like a city training, you're going to be able to have access to some really good health data. State health facts, these are Kaiser Family Foundation, so this is one of the places you can look. They are not going to have those problems, so you can have national and state level data with over 80 health indicators. So there are places like that where you're going to be able to get information. There's also county health rankings. So you can see this is Robert Wood Johnson Foundation and the University of Wisconsin, so outside of government. there are places that pull information and are going to have that available to you. IPUMS is another organization that is in, I forget which university right now. And you can see they've got population survey data, they've got census data, they've got international things and global health things. So lots of different data that is available to be able to use through this. So all of these, you visit the site, you need to read about what the data is, see if that data is applicable to the work that you're doing, if that's the kind of thing that you want. And then you can go in and get the information you need. And you can see they talk about all the different projects that they have. They have quite a few. And so you can learn more about all the different things through IPUMS. So there are lots and lots of other sources like that. Again, the Agency for Healthcare Research and Quality that talks about medical expenditure. Again, this is a government site, so we're not sure how much is going to be left in here, but we've got some of these other things and world things that will be available. So it may be we have to find data in a slightly different place, but we can manage. And as I said, you are always and always should come and see the librarian for your subject area, and we will help you find information on all of these things. There are a couple of really great universities. Here's something from Michigan and Cornell that have lots of data listings as well. So we have some, but they have even more. They've got specialty librarians just for this sort of thing. And so they're useful places to find data. And again, we don't know how much is going to be available for the US government, but there are other places that you can get. Australia has lots of open data. Canada has lots of open data. So there's open data around the world. There really is. More and more places are doing that kind of thing. So, as you know, if you think of an organization, there's lists of organizations. That's one way. There is also a registry of research data repositories, R3 data. And you can go in here and you can say something like maternal health. And so I can see all sorts of different things. So I've got 4 different population services that I've got here. HRI and Global Health Observatory. So I can go to any of these things and it gives me the URL for the repository, the contact information. So this kind of metadata that we have about this gives me some subjects here, gives me a description of that as well, keywords, tells me about the institutions, World Health Organization that are collecting this data, the terms of use for the data, and the standards. So it gives me a little bit of information about the metadata that's being used, the interfaces, those kinds of things. So basic information. So then I can go to the particular site that I'm interested in. And so that you can see this gives all sorts of maternal and reproductive health. So I can go in here and see all of these different things that I can find. So maybe birth by cesarean section by country, and I can download it. The filter data, I can download the complete data set. So it gives me that information here. In this case, it does not have any sort of a, it's got, let's see, a CSV has text and values, codes, text and values. So it does give me something in that CSV. If I download it, it will give me some inches. So probably that complete data set is what I would want. So that allows me to download that data if that's the data that I'm interested in. And you can see here, this is one of the things with World Health Organization data is it's the years, the year ranges are very different for all of these things. So that is definitely makes things a little more complicated as you try to put data together from different places. So that's always something you're going to be sort of looking at. Um, so that's, and then Google, um, you can do various things. You can put in the topic you're interested in. You can use .gov or .org, depending on who you want to have in there. And then you use a file type XLS for Excel spreadsheet. So that would be one way. And then there's a data set search that Google has been working on, and I have not checked this recently. So let's see. Okay. Um, uh, Risk of preterm birth. So it's got 100 plus data sets found. So I can go through and look at all these things, and they're all coming from different places as well. Um, and so you can see in some cases there's going to be licenses, and probably here we go, usage rights, commercial use allowed, non-commercial use allowed. So I could limit it to just non-commercial use allowed, or even commercial. That might give me even more as well. But it will give me information. You know, I can go in and see that this is at Harvard Dataverse. There's the unique identifier to get for it. Here's the license. Here's the description. So I can learn about these data sets before I go and click on it and get into um, the information. And you can see here I can access the resource here, getting a little bit more information, tells me about it, and I can go in. And there's how to cite the data sets, the description, the keywords. There's metadata for it, terms and versions is also in here. So all of that is in here. Um, okay, let's see. Just seeing there is no download on this page unless I'm totally missing it. Public domain. It says there are no files in this data set. So maybe I'm here. It doesn't have this old one in there. So I may have chosen the one thing that I can't find. But you can see the R3 data, it searches places like this. So the information would come up through there as well as the Google data. Okay, so downloading, as we just saw, every site is different. You might have to look around. You might not always find something that will allow you to do that download. You can, you know, we saw some stuff where there were people to contact, additional info. So here, program contact email. If you're having problems, that's one of the things that you can do is contact whoever is the data owner and see if they can give you some help for something like that. You're going to have to look around to find the documentation, look around to find the downloads. Every site, there is no one way for them to do it. It's just like finding a PDF with an article. There is no one way to find everything. So you probably will have to do some looking around when you get to it. And then when you find the data, remember what we were talking about. Do you have enough information to understand what every column means, or whatever the data is? Do you have enough information to understand what that data is so that you can actually use it? You know, is it going to be something that can easily be cleaned by Open Refine so that you combine it with other data sets? Those kinds of things that you might want to do with the data that you find. So those are the basics. Thank you. Hopefully that was a little bit useful, gave you some ideas. If nothing else, if you are in public health and exercise and nutrition science, please feel free to contact me and I can help you with the specifics of what you're working on. Let's see, if you are in other areas, if you go to this menu, the people and departments, there is a subject specialist librarian list. And so, you can see there's arts and letters in there, education. So all the different schools are here. And click on whatever you're interested in. This is Kat, who has been the organizer for Love Data Week. And you'll be able to see schedule an appointment. And we all have this kind of thing. Kat has some very specifics. And so, if you want to, you can find her office hours and you can schedule some time with her. It works for all of us like this. So please don't hesitate to use any of that information, the information in something like this to let us help you. And the other thing, just to make you aware of it, we have these subject guides. And so again, it's sort of like finding the subject librarian, look at the subject you're interested in, biology, biological sciences here, and Sarah, who is our science librarian, looks after biology and things like that, chemistry. You can find the person here, and there's an email and also a booking for that person as well. So don't hesitate to do any of those things. We are all happy to help you. If we don't know the answer right away, we consult with our colleagues, both here and at other universities as well. We all are part of networks at the different places. So please feel free to try any of those places. Contact us. We're more than happy to help you find the data or find the literature that you need. So don't hesitate to ask your librarian to help. So thank you very much. And Kat is recording this, so we'll make sure this recording gets into the Love Data Week guide as well. And like I said, please contact us. We're more than happy to help you with this. And I'm glad it was informative. Thank you. Any questions? We have time, so if you have any questions, please ask.
Hello, I have a question.
Okay.
Thank you for the presentation, was amazing. I'm from the HealthLink Center.
Oh, hi. I know Sam over there.
Oh, yeah, I work with them. So I have a question. Now with all these data sets that are going down from the government, is there a way we can, it's more like a technical question though, is there a way that we can download those data sets and upload them in another repository for example, for our researchers to use in the future?
There are groups already doing that, and I actually have been collecting up some of the links for that, and I planned on adding a page in the data services and the data guides to be able to do that. But there are groups, a couple of big universities that have big data repositories are starting to do things. Some of them, like in one of my guides, what is it? It is the, let's see, reproductive health care. Know Your Rights. That's already going to the Internet Archive. So the Internet Archive has been archiving the pages. So some of the pages are being saved, but also some of the data sets are being, and then there is an end of term file that they've downloaded. I don't know if they got to it in time, but there is an end of term for each president. There's an end of term download of the government websites. So hopefully the people, the data librarians and data scientists who are doing these things, who are saving these things, hopefully they will collect as much as possible so we can get to it. But like I said, I will be setting up a guide that's on my to-do list. I will be setting up a guide, and probably it will go on the, let's see, the research data services. Let me show you. So let me find this. Okay, so the guides by type, there's a topic guide. So there's a research data services. And so this will be updated with that information. And there is also in the guides, I just put in data here. There is, there's a health data one, which I can't, no, that's not it. I don't even recognize this one. Sorry, there's always something new. Let's see. I know there's a health data. What was the title of that one? Do you remember, Kat? Health statistics and data, that's what it is. So this guide, we will be putting in, under the United States, we'll probably put something right up at the top once we have something together, to tell people where to find federal government data.
So if for any chance we need, for example, like a specific data and we don't find it anymore, maybe it's a good thing to contact you to see if
Yes,
like,
definitely. Like I said, I know because I've had something, I found something just came on the weekend. Let me show you something like this. So this is one just about the transition. So this is like University of Minnesota, who has got data repositories there. And so they've got data rescue events, things like that. So these silencing science trackers, so they're keeping track of these different things. They've got this data rescue 2025 has been trying to find the different things. Alternative data sources are in here as well. So I will be collecting together these kinds of sites. We don't have enough people to take care of all this. But I will be collecting together the groups that are doing this so that with any luck, we can go in and find, figure out somewhere where you're going. Here's an archive of data.gov, way back machine. CDC data sets uploaded before January 28th. So these kinds of things are the ICPSR, although I checked ICPSR because we have a membership in that through sociology. And most of their data sets aren't that new compared to what is coming off of the CDC. So these kinds of things are the kind of things we'll put up and what we need to look for. So I can put that, get back to, I just want to get back to the home on this. Yeah, there. Doesn't have a nice neat. But there is a link for you for this one. But we'll collect together others similar to this as well.
Okay, great. Yeah, I know that Sam and his team is working on downloading some of the data they are interested in, but it's actually impossible to download everything. So it's good to know
Yeah, it
that
is
someone,
very much so. And we have no idea, how much we'll still have, what will still be collected. I mean, that's going to be the biggest issue is we don't know if they will continue to be collected. And that's why with that one, this particular, this behavioral risk factor surveillance system, it seems to be fine taking a quick look at the page. But I'm sure some of the questions in this are no longer going to be available. If they have to do with gender, if they have to do with climate change, anything like that, they're going to be removed. But the states are the ones who conduct the survey. The CDC just pulls it all together. And so there is, I had it up at one time. There is a state version of this page for California, for all the other states. And so we can go, you'll be able to go to the state pages. And as long as the states are not, complying ahead of time or changing, it's saying we're still going to do this, the states will have that information. So there are other ways that you can get to this. So please ask. I guess like everything else, please ask us. I mean, we're more than happy to help, and we will do what we can to find out. And all of the data librarians, I know so many people who are part of a couple of different data organizations, and so we question each other. We ask, "Have you seen this?" and share things on those. That's how I find out about these things, because everybody's sharing what they know. So that's one way to keep going with these things.
Got it. Thank you. I will share it with the team.
Okay, thank you. And let them know they can contact me. Happy to help. Any other questions? Well, thank you very much again for coming and thanks for the questions. And hopefully it'll be useful to you. As I said, Kat will, I'm sure, email out once the recording goes up and it's into the guide for Love Data Week. So thank you very much. Good to see you. And please let us help us with your research.